Today's lecture will be a brief look at CNS development and adult derivatives that come from primitive brain swellings, the first set of which are called the three primary vesicles. We start out around the 4th week of gestation with neurulation. That means we're creating the neural tube and all the neural structures that eventually develop in the adult. On the left you see the neural tube literally looks like a tube, which then develops a swelling at one end. That end is the cranial or cephalic end, meaning that's where the head or the brain will be. The opposite side is the caudal or tail end. The part that's swelling represents an area of rapid growth or mitosis. So where the whole neural tube is growing and the cells are dividing, the portion of the swelling is where this is happening more frequently and more rapidly. Eventually we go on to make 3 little swellings called the 3 primary vesicles. So looking at this image, on the left we have a little ice cream cone looking thing. Remember that this is the consequence of neurulation, where the neural tube has folded and created 2 ends, the cephalic or the head portion, which is up at the top, and then the caudal or tail portion, which is at the bottom. The topmost part, which I've illustrated in this image as a reddish color, is the first of 3 swellings. This is called the forebrain, or sometimes the prosencephalon. Right below the forebrain is the midbrain, drawn in green, and below that is the hindbrain, also sometimes called the rhombencephalon. The prosencephalon or forebrain will then split into 2 more swellings, with the topmost one being called the telencephalon and the one just below it being the diencephalon. The midbrain remains as one swelling that then goes on to be called the mesencephalon. This is also shown in the image as being green. The rhombencephalon or the hindbrain will also split into 2 more swellings, with the more top one being the metencephalon and the lower one being the myelencephalon. These are drawn in purple. Then we also see that the spinal cord is in both images in yellow. Here is an image of a fetus showing you the arrangement of the neural tube and where those swellings are in relation to one another, as well as in relation to the fetus itself. So these are the 5 secondary vesicles. Remember, we started with 3 primary vesicles, and they go on to develop into particular structures of the brain. So let's look at what those structures are. Starting at the top with the telencephalon will go on to become the adult brain structures such as the cerebral hemispheres, the corpus callosum, which connects the 2 hemispheres to one another, most of the basal ganglia, the insula, which is an area found deep within the lateral sulcus between the temporal and parietal lobes, and then the lateral ventricles. Remember, the ventricles are hollow spaces where cerebrospinal fluid, or CSF, is found. Next is the diencephalon. The diencephalon will go on to become adult brain structures including the thalamus, hypothalamus, subthalamus, epithalamus or pineal gland, the retina of the eye, and the 3rd ventricle. Again, ventricles are hollow spaces that house CSF. All of these aforementioned structures come from the prosencephalon or forebrain. Both the telencephalon and the diencephalon and the adult derivatives come from the prosencephalon or the forebrain. Thankfully, the midbrain, sometimes also called the mesencephalon, stays as one structure and doesn't split off like the forebrain and hindbrain. So both the primary and the secondary vesicles of the midbrain can be called the mesencephalon. Of the 3 primary structures that we saw, the 3 primary vesicles, it may be called the midbrain or it may be called the mesencephalon. But once it becomes part of the 5 secondary vesicles, it will be called the mesencephalon. The adult structures that develop from the midbrain or the mesencephalon include the cerebral peduncles, the tectal plate, which includes the corpora quadrigemina. The corpora quadrigemina literally means body of 4 twins. In reality, what it is 4 little bumps that are a set of 2. You have the superior colliculi and the inferior colliculi. We have 2 superior colliculi and 2 inferior colliculi. So, a set of 2 twins will give you 4. Gemina or Gemini literally means twins. Then we have the cerebral aqueduct, which again will contain CSF. Now we have the hindbrain or the rhombencephalon. This swelling will also go on to become 2 more swellings, named the metencephalon and the myelencephalon. The structures that come from the metencephalon include the pons, the cerebellum, and the 4th ventricle. The structures that come from the myelencephalon include the medulla and the 4th ventricle. And that's not a typo. The 4th ventricle is developed from both the metencephalon and the myelencephalon. So all of these structures on this page come from the hindbrain or the rhomb encephalon. Alright, I promised that this would be a brief video. Hopefully it helped you. Check out Psychomicro on these social media platforms and leave any suggestions or comments below if you feel so inclined. Thank you very much for watching and best of luck on your studies.